How to prevent soreness after blood tests for lymphoma. Experiencing soreness after a blood test is common and usually mild. This discomfort often arises from the needle insertion and blood withdrawal. If you are undergoing tests for lymphoma, here are some practical steps to help prevent or minimize soreness. First, the technique used during the blood draw is crucial. Make sure that a skilled healthcare professional performs the procedure. Proper technique can significantly reduce tissue trauma. After the blood draw, applying from pressure to the puncture site for several minutes can help minimize bleeding and bruising, which can contribute to soreness. Keeping your arm elevated and avoiding heavy lifting or strenuous activities for a few hours can also aid in recovery. If you are particularly concerned about pain, consider asking your healthcare provider about using a topical numbing cream before the blood draw. This can help reduce discomfort during and immediately after the procedure. Another effective method is to apply a cold compress to the puncture site. Using a cold pack or ice wrapped in a cloth for about 10 to 15 minutes after the blood draw can help reduce inflammation and numb any soreness. Just be sure not to apply ice directly to the skin to avoid frostbite. Staying well hydrated before your blood test can also make a difference. Good hydration helps make your veins easier to locate, which may reduce the number of needle attempts and, consequently, soreness. Eating a light meal beforehand can help maintain stable blood sugar levels, reducing the risk of dizziness or faintness that sometimes accompanies blood draws. If you have multiple blood tests for lymphoma diagnosis or monitoring, try to alternate arms or sites. This allows the puncture site to heal and reduces cumulative soreness. After the procedure, it is important to keep the puncture site clean and dry to prevent infection, which can lead to increased pain and soreness. If soreness persists beyond a day or worsens, or if you notice significant swelling, redness, or warmth, it is essential to seek medical advice. These symptoms may indicate complications such as hematoma or infection. In the context of lymphoma, blood tests are vital for diagnosis and monitoring. They often involve repeated sampling to check blood counts, organ function, and lymphoma markers. By minimizing soreness and discomfort, you can improve your overall experience and compliance with necessary testing protocols. Always communicate any concerns about pain or anxiety related to blood tests with your healthcare team. They can provide support and reassurance, ensuring that the procedure is as comfortable as possible. Remember, proper technique and post-test care are key to preventing soreness after blood tests.